Welcome back, everyone, and today we want to talk about what we call orthodontic retention or retainers, okay? And this is probably one of the most important parts of your treatment, and people don't really think about it as part of your treatment because it's over. Your treatment's over, your braces are off, your Invisalign is done, but the retention or the maintaining of your new smile, of the alignment of your teeth, of your new perfect bite, we have to do something to make sure it stays that way, okay? It's not magic. There's nothing that's going to keep your teeth in that new beautiful position no matter how good of an orthodontist we think we are. There's always some chance of relapse, which in some patients is greater than others, and we can advise you based on your case, but we always want everyone to follow a specific retention protocol, customized for their type of retainer and customized for their type of treatment. So the analogy I like to use is that if you like to get your nails done, or you like to get your hair done, or a haircut, or hair dyed, whatever kind of things you like to do as far as that, or even if your car's not going to run unless you do maintenance on it. So your car has to get your oil and filter changed. Your nails have to either be trimmed, painted, your hair has to get cut, colored, whatever it is. If you want things to look the way you like them to look, you have to do, it takes effort on your part, okay? So your teeth are no different. Your new smile is no different. Without some effort on your part, it's not going to stay perfect and beautiful like you want it to. Okay? So let's talk about different types of retainers. And there's really two basic kinds of retainers. One is removable, the other one is what we call a fixed retainer. Some people call it permanent, but a fixed retainer is something that's bonded onto your teeth. And for example, if we look right here, okay, you look right here, you see that? You see that really thin little wire? And this sample shows behind someone's bottom front teeth. So this is someone's teeth, right? And we look behind the bottom front ones, we can see this fixed retainer. And it's a very thin wire. It's bonded on with bonding material, the same thing we use for putting your braces on, or the dentist uses for tooth-colored fillings. So it's smooth, you barely know it's there after a couple days. But this is going to maintain your alignment of your bottom front teeth. And what we know as orthodontists is that the teeth that are most likely to shift over time, whether you had braces or didn't have braces, or had Invisalign or didn't have Invisalign, the bottom front teeth tend to be the most unstable in the average person's mouth. So we want to try to eliminate that possibility if we can. So we will recommend what we call a bonded or a fixed retainer. Okay. Now, patients who shouldn't have this, or we won't offer it to, are patients who simply don't have good hygiene. If you don't brush your teeth well, you show us during your year or 18 months of treatment that the hygiene is not really kept up to the standard we want, then this is probably not the best idea for you. But otherwise, this is a great way to really make sure you don't get that lower crowding in your front teeth as you age or as time goes, or if you forget to wear a retainer, which unfortunately we all know is more common than we like to think. So that's fixed retention. And we commonly use it on the bottom because that's the most problematic area for most people. Now, for example, some people come in with a big space and gap right in the middle of their front teeth. We'll often use it for that too, because something like that is highly recurrent. Okay, so that's fixed retention. Now, the other types of retainers are what we call removable retainers, and there's really two flavors of these kind of retainers. One is a traditional, what we call Holy style retainer. Okay, you can see that right there, and it's got the acrylic and the wire kind of clasps or clips that snap onto your teeth, and it holds it in place. The main benefit of this type of retainer, it's really durable, okay? If you take care of this, it could probably last you the rest of your life, okay? So that's really the main benefit of this. One of the downsides of it is that you're going to see a wire in front of your teeth. And sometimes it doesn't quite hold everything as perfect as we like them to stay, but perfectly functional. We still use these a lot, and in some cases it is the better retainer in select cases for certain people. So again, everything is customized for the patient and their treatment, but this is the traditional style of removable retainer. Okay, now you see this is kind of like the gum color of your mouth, the boring kind of pink color. A lot of younger kids will like doing these kind of retainers simply because it doesn't have to look like this. It can look like this, okay? So we let you customize, pick out your color, patterns of colors, glitter, animal patterns, stripes, camouflage, whatever you want, even decals. We can put different decals back here inside the retainer. So it really can be customized, and young kids really have a lot of fun with these, if they need a retainer. So that's another kind of retainer, the Holy style acrylic with wire retainer, okay? The third kind of retainer we're going to talk about also is removable, and it's what we call a clear retainer, or an Invisalign style retainer, or really called an Essex retainer. And you see here's a model of teeth, and it looks just like this, and it snaps onto your teeth, much like an Invisalign tray would, or even like a clear bleaching tray would. And it's pretty durable. If you look at it, okay, you can bend and flex this, and the newer generation plastics that we use for these types of retainers are a lot stronger and more durable, and they hold their shape a lot better than the older style used to. These used to be more aesthetic but lesser quality alternative years back. Now they're really, we really consider these the standard of care these days as far as removable retainers. And you can see how they just snap onto the teeth. Okay, and what's important to know is that while these are much more durable than they used to be, they might not last you forever. Okay, like the holier style retainer. Like we said, that's probably the main benefit of the old school acrylic and wire retainer. Lifespan of these retainers, especially with the material we use in our office, is usually at least 2 or 3 years now. So they've really gotten a lot better. And what's one of the most common issues people have with retainers, especially if you're a child, adults too, it happens too, you lose it, you throw it out. So we'll always give you 2 of these retainers per arch if you need them in our office. So that's one of the benefits that we like to provide our patients, is not just 1, but we're going to give you 2 so you have a backup. Now, the real cool thing about any retainers really, but really specifically for these, is that if you lose it, or you lose both of them, because we're going to give you 2. If you lose both of them, normally you would have to come in to an office, take a mold of your teeth, send it out to the lab, and get a new retainer. Now, your teeth are digitally saved on really we would consider the cloud. Just like your iPhotos or your Google Photos on your phone, everything goes right up to the cloud, right? Your teeth are no different now, because we scan your teeth in a digital scanner. It takes about 2 minutes to scan your teeth, and it's saved on our server, or even by our lab. So if you lose it, you call us, we order it, and within a few days we have a new one back in the office for you. And even if your teeth shifted just a little bit, you were away on vacation and you came back 3 weeks later, you didn't have a retainer, and you just got your braces off, and your teeth shifted a little bit, we make this brand new retainer for you. You put it in your mouth, and guess what? Your teeth go right back to where they were, which is really great. So removable retainers, permanent or bonded or fixed retainers, those are the 2 types. But the most important thing is everyone needs some type of retention if you want to maintain that beautiful, perfect smile that you got with your orthodontist. So we'll always customize it based on your treatment. If you prefer a certain style over the other, as long as it's appropriate for your case, we'll do it for you. And remember, we'll give you 2, okay, just in case. But I hope this answers questions about retention, retainers, because they're just as important as your active treatment, as your braces and Invisalign. So I look forward to seeing you guys at the next video, and hopefully you come in for a consultation soon. Have a good one. Bye-bye.